I am Ruth McEwen, Advisory Council member serving on the Northwest Senior and Disability Services Advisory Councils. I want to welcome candidates, incumbents, and Advisory Council members to the 2024 Candidate Interview Forum. This program features candidates and incumbents from districts serving Clatsop, Marion, Polk, Tillamook, and Yamhill counties, and is sponsored by our Senior Advisory Council and our Disability Services Advisory Council. Northwest Senior and Disability Service is a local governmental organization that provides Medicaid, Oregon Project Independence, Older Americans Act, and grant-funded programs. The mission of the Northwest Senior and Disability Service is to promote dignity, independence, and health, honor choice, and empower people. The assistance and support we provide to consumers includes information, assistance, in-home and community-based services, financial and medical help, meal site and home-delivered meals, options counseling, adult protective services, Medicare counseling, and peer mentoring, money management, as well as health and wellness programs. Because of the number of state legislative districts that our service area covers, we have invited a large number of candidates to our candidate interviews. Each candidate has been given information on the format used in these interviews. Each candidate will be introduced by a member from the advisory councils, and then candidates will have the opportunity to answer questions which will be timed. We thank these candidates for their willingness to share their views about services for Oregon seniors and people with disability.
Hi, my name is Stephen Meneses. I'm a member of the Disability Services Advisory Council at Northwest Senior and Disability Services. Today I'm interviewing Scott Hooper. He's a Democratic candidate for Oregon Senate, District 12. We'll be asking candidate Hooper questions related to seniors and people with disabilities. Welcome, candidate Hooper. Thank you for sharing your time with us.
Thanks for having me.
I have a series of 5 questions. Tell us about your platform and experience that would encourage a senior or person with disabilities to vote for you.
Well, thank you. During my 26 years as a lawyer, I've worked with clients with serious injuries. Most of those were suffering with severe disabilities, brain damage or paralysis. And I have quite a bit of experience in dealing with the folks with disabilities. But my very first case, one of my very first cases when I started representing individuals, was a widow woman that was in her 80s, and she had been basically a bad guy in a suit, had taken all of her money and locked it up and taken about a third of it as a fee. And so we pursued him and got all of her money back. And I followed that with a lot of nursing home cases where you see the worst of what can happen in a nursing home due to neglect. And through that career, I have initially worked with other people with disabilities, but most often my opponent in those cases was greed. It was people or companies that put money and profits over individuals and took advantage of the most vulnerable of our population. And that's one of the reasons I'm running. I'm running to counter effect the greed that we have in our economy and how it affects vulnerable people, both seniors and people with disabilities, as well as other people. It's in particular, corporations and private equity groups are trying to take over the healthcare and nursing homes. And I oppose those efforts, and I support legislation to roll back the corporate takeover of the practice of medicine. One of my most important policies that I'm pursuing that affects seniors as well as people with disabilities actually affects most of the working people and retirees in our country and our state of Oregon, and that's housing. Quite frankly, we need more housing. As a senator, I would work to end homelessness. Within my 4-year term, I would focus on 3 groups: veterans, children that are homeless, and seniors and people with disabilities. Excuse me. And I think it's important that we focus our policies on solutions to those problems as they affect not just seniors and people with disabilities, but those very vulnerable groups that I mentioned before. And thank you.
Thank you. How would you prioritize state funding, including funding that is matched with federal funds, such as Medicaid, for services to an ever-expanding number of seniors and people with disabilities?
I think it's a multifaceted approach as it relates to Medicaid and funding and the needs of seniors and people with disabilities. I would seek input from organizations such as your organization and other organizations that deal directly with providing funding, but also providing outreach and care. I think that too often legislators don't go and talk to the people that are both directly providing services, but also receiving the services. And I think that that's the first step in any approach. Healthcare is becoming more expensive and harder to access for everybody. That's especially true for smaller cities and rural areas. It's like my district. I think we need to target what's driving up those costs, and that helps us with Medicaid and Medicare if we target the costs on one end. And as I said earlier, I oppose corporatizing medical care. I support rolling back equity fund ownership of nursing home and care facilities. I support reducing costs and increasing access to care for chronic conditions that require repeated visits to healthcare professionals and ways to provide that care more efficiently and at lower cost without reducing the level of care or service. I think that we need incentives to bring healthcare providers into rural areas and small towns. Right now, it's really expensive for a doctor to move to McMinnville or to Newburgh or Dallas, and the pay can't keep up with the cost that they have to pay to live in our small communities. I think we need to figure out a way to address that. On the other end, we need to talk about funding. We have to protect funding for Medicaid. In fact, we need more funding for Medicaid. And it is critical that we protect the funding that there is now. We need to make sure that the state expenditures are directed for the maximum impact possible. We need to make sure that we reach as many seniors and people with disabilities as we can. And we need to do that. First, outreach is a central component as we talk about these issues today. Outreach to seniors and people with disabilities is a critical step in this very difficult process. The outreach needs to include advising seniors and people with disabilities about the rights that they have, the access they have to healthcare, and options that are available to them, and the services that are available to them through the state. We also should look to and learn from other states on the best and worst practices. It's important to look out amongst, and it's not just states, it's internationally. And I'm not talking about me getting on a plane and flying all over the country like some legislators like to do. I think that our government needs to really look and explore other options and other things that are going on. Some states have enacted a comprehensive approach, and we'll talk about a comprehensive approach in a moment in a later question, I expect. It's not just health and human services that's in the approach. It's looking at transportation needs, employment, income security, and having a very broad, multi-problem, I guess, approach to dealing with providing quality of life services to people, both seniors and people with disabilities. One such one is the Older Vermonters Act, where they embraced all of those issues and pulled them together into a comprehensive plan. I support science-based and data-driven solutions to these problems. Thank you.
Thank you for your response. It is becoming increasingly challenging for seniors and people with disabilities to obtain housing due to constantly rising housing costs and an insufficient supply of disability accessible housing. What will you do on a state level to prioritize affordable, accessible housing?
I'll start with the fact that providing affordable housing is one of the most important things in my platform, one of the most important reasons why I'm running. We don't have enough houses in Oregon. Everything related to housing and homelessness falls off of because of that. Right now, about half of the renters don't have enough money to pay basic necessities. 316,000 people in Oregon don't have enough money after they've paid their rent or their mortgage to pay their necessary bills. That's more so for seniors and people with disabilities. We've got to build more housing units. We've got to build 140,000 housing units right now just to meet the demand. We need 500,000 housing units over the next 20 years. That's the long-range, long-term problem. But here's the thing everybody needs to understand. Affordable housing is a moral imperative. We have a moral obligation in this country to make sure that people can find affordable housing, period. It is immoral to me, and I believe it should be immoral to everyone, for veterans to be living on the street, for children to be living in cars, for seniors to be able to not afford clean and safe places to live, or for people suffering from disabilities to not have even basic shelter. And so the short-term solution to me is that we have to find shelter for people. And it's a giant problem. Housing and homelessness is a giant problem. But you know what? Let's focus on a couple of things. Let's make a commitment that we're not going to have veterans, children, seniors, and people with disabilities on the street without shelter. We can do that. We can make a commitment that we're going to get rid of homelessness in those vulnerable populations. We're going to at least provide them shelter and a pathway toward getting permanent shelter. We must make the commitment to those groups. And I'll tell you that I will commit to my 4 years to spending time every day on that issue. And the Oregon legislature needs to spend every single session talking about these issues and working every single issue. Every single term for resolving this problem. The governor's made a commitment of 36,000 units for the next 10 years. We've got to hold her to that. We've got to hold the legislature to that. And we've got to hold the people of Oregon accountable for doing that and providing these things. It's time for us to say, in this not in my backyard philosophy, and say, we're going to make houses for folks. And we're going to build quality, affordable housing for folks. And if we don't, shame on us.
Thank you for your response. 2 more questions. What would you support at the state level to prioritize access to healthy and nutritious food for seniors and people with disabilities?
My wife drove for Meals on Wheels and loved it. I had the opportunity to volunteer for a few of the opportunities where they were in the community center and feeding folks, but she got to drive Meals on Wheels and loved delivering food for her clients and loved spending moments of her time in the day visiting with those folks and providing the interpersonal relationship that's so important to folks that are in the Meals on Wheels program. She keeps up with those folks from her route still to this day. I support expanding access to nutritious meals to seniors and people with disabilities, particularly in rural small towns. It's harder. These programs are harder in the area where I live in Yamhill County and rural Polk County. We need to expand Meals on Wheels. We need to expand grocery delivery in rural and small towns. We need to, but first, we need to expand senior outreach and community services. It's the best option is to bring people to the food. The best option is to bring people to community centers because there we can provide warm meals, nutritious meals, good quality meals, but we also can provide companionship, which helps resolve the problem with isolation that so many folks in these two communities that we're talking about experience. We also have a chance to put eyes on them to see how they're doing, make sure they're okay, and provide them with information about access to other services. Expanding clean and reliable renewable mass transit is also an important component. The more ability that people have to move around, whether it's seniors or people with disabilities or working families or people who can't afford transit, the better the ability they have to move around, the more access they have to jobs, the more access they have to socializing, and the more access that the folks that we're talking about here have to the services, both nutritional and food services, but medical and healthcare services.
Last question. What would you do to address the behavioral health needs for older adults and people with disabilities?
Behavioral health, like mental health, is a critical component of healthcare. It doesn't get talked about enough. But behavioral health is synergistic with other aspects of care for our seniors and people with disabilities. Taking care of people and improving their quality of life improves their behavioral health and their mental health. And good behavioral health, providing behavioral health services, improves their physical health. For example, fall prevention. Helping people learn about fall prevention, both within the places that they live, but also in the way that they carry about their days, their day-to-day living, is an important aspect to keep folks healthy.
We've been visiting today with candidate Scott Hooper, a Democratic candidate for Oregon Senate District 12. Thank you, candidate Hooper, for joining us today for this interview.
Stephen, thank you very much for having me.
You're very welcome. Appreciate your thoughtful responses.
Okay. Thank you. Thank you for what you're doing here.
You're welcome.
I want to thank the candidates on behalf of the members of the Senior Advisory Council and Disability Service Advisory Council of Northwest Senior and Disability Services for attending our candidate interviews. We hope the information that has been provided will help you make informed choices when you vote. The opinions expressed here are not endorsed by Northwest Senior and Disability Services. For more information or to get connected to services provided by Northwest Senior and Disability Services, call 1-866-206-4799. The advisory councils for Northwest Senior and Disability Services would like to thank Capital Community Media for their production of the forum. Thank you for watching.